Good morning. Today we shall see how to manage diabetes during Ramzan fasting. So you all know during Ramzan fasting they take their breakfast before 4 o'clock itself, and they break the fast after 6 o'clock. So whenever a person is a diabetic who wants to fast, they have to be very careful. The dose of the drugs have to be adjusted, the morning dose has to be reduced, and the evening dose can be maintained the same or increased depending on how the patient is going to take the food. The problems which can be there are increased risk of low sugars, hypoglycemia. In type 1 diabetic people who are fully insulin dependent, there can be diabetic ketoacidosis. So, better to avoid fasting when a person is a type 1 diabetic. If a type 1 diabetic wants to fast during the Ramzan period, they have to be on continuous insulin pump. That's a very important thing which the person has to follow, otherwise, the patient will land up in ICU. Then another risk is a risk of dehydration, which can increase clotting situations and cause stroke. So it's very important to take care of the diet, prevent dehydration. So during the phase when the person is not fasting, they have to drink a lot of liquids. The dose of drugs can be adjusted in a type 2 diabetic people. You should not involve yourself in excessive physical activity during the Ramzan period because you lose a lot of energy. Again, morning diet can have complex carbohydrates which are slow in digestion and that can work for the whole fasting period. And the next thing is check your sugars always, whether you're a type 1 or a type 2 diabetic. Type 2 diabetic, check your sugars. If the sugar random goes below 60, stop fasting. Again, if the sugar goes beyond 300, stop fasting. Again, if you have fever or any sickness or illness, stop fasting. So that is very important. Before you start fasting for your Ramzan month, better check up with your doctor, adjust your dose of the diabetic drugs which you are taking. Very important for all the diabetic people who are going to fast during the Ramzan period. They have to know how much to adjust the dose of the medications to be taken. They have to be monitoring it properly so that there is no complications during the Ramzan month and they peacefully and happily fast during the Ramzan period.